Yeah, hi everyone. Again, welcome to my channel. This is Dr. WAN. Please don't forget to subscribe and share the link with your fellow members, loved one, and friends and relatives and all whatnot. Yeah, so I'm here today to address an issue is of great concern, and I really want to make sure that this message goes through. It was shocking to hear from a member that she doesn't know what are the symptoms of diabetes. That was her conversation on the phone, and she was actually pleading for me to make a video to actually summarize it for her to understand. And I felt too bad, so I decided to make this video dedicated for this person. Please, so listen carefully to understand what it is. Many people have type 2 diabetes without realizing it. This is because symptoms do not necessarily make you feel unwell. Some people do not have symptoms. Some symptoms may not appear for some time. Now, let's look at the common signs and symptoms. The most common signs and symptoms of undiagnosed or poorly managed type 2 diabetes include the following: feeling thirsty all the time, drinking excessive amount of liquid, or unable to quench your thirst, peeing more than usual, particularly at night. Here, we need to be careful here. I want to make a point here. It depends also the age here. So don't get me wrong. If you are peeing more in the night, the first thing to assess is your age. How old are you? If you are over 50, there are chances that there's something going wrong with your prostate. That's down there. There's something going wrong there. You might be having inflammation of the prostate, which that topic, I will make another video for that to actually explain what it means. If you are under 40, then we cannot talk about diabetes. So whenever you go to the hospital, make sure they assess both things. So they have to do PSA value and the HbA1c. So the PSA value stands for prostate specific antigen. That one has to be done if you are over 40, because once there's that inflammation on that gland, that's what happens at times in the night. So let's cut it short and focus on these diabetic symptoms and signs. Now, the next point, it is feeling tired, lack of energy, sleeping more than usual, losing weight without trying to, frequent infection, cuts or wound taking longer to heal, numbness, pain, or tingling in your hand and feet. That's another one. So there's what we call carpal tunnel. I will make a video on that, carpal tunnel syndrome, for you to understand what it means around this part of the hand. So you get that feeling there. Then the next one is blur vision, because it affects the eye. And that's so when we talk about this case, I'm referring to the medical term should be microvascular disorder, because we have macrovascular disorder and the microvascular disorder. So if you are having trouble with your vision, therefore you are having trouble with the nerves around the eyes, and same thing also with the arteries of the legs. That's why you are sitting point, if you have uncontrolled diabetes for years, they end up amputating your leg. So you fall under microvascular disorder. That's what happens. Whereas for macrovascular disorder, it is organ failing. Organs like your heart start behaving funny, not able to pump blood around the body. So that's the point I want to make it clear to everyone. Itching around the penis or vagina, or frequent episode of thrush. That's another good one also, which we will talk about it further. Risk of developing, so we shall see now the risk of developing type 2 diabetes. So you are more at risk developing type 2 diabetes if you are over 45. Have a close relative with diabetes, such as parent, brother, siblings, or sisters, or an adult who is overweight or has obesity. So meaning that value I've been saying, hip waist to hip ratio is greater than 1. So make sure your value waist to hip ratio is less than 1 to be on the safe side. Otherwise, you'll be in big trouble. Another thing, it is BMI, body mass index. That one also has to be taken into consideration. Having said that, we go ahead. So another point is, if you have had gestational diabetes during pregnancy, that's another point, or physically inactive, what I call it couch potato. For example, if you take less than 30 minutes of physical activity most days, if you have high blood pressure, high cholesterol, low HDL cholesterol, or high triglyceride, that's another thing to be taken into consideration. Have a history of heart disease, have a medical condition that requires long-term steroid use. So here's another very important thing. Remember, in one of my videos, I talked about medication that can create trouble, that can make you become diabetic, and corticosteroids are one. I will make another video on that to explain the mechanism. That video will be dedicated for medical students because it involves kind of some terminology to be used. So I will come to that one. Having said that, we'll go ahead. If you are a member of the traveling community, it's a group of people that they don't have a fixed place where they live. They are kind of gypsies. So being gypsies, they do not have time to cook decently. I've been thinking about dead food and living food. So living food are green, dead food are meat, fish, and you can name the rest. So that's the message here. If you are also from South Asia, Chinese, Hispanic, African, Caribbean, or Black African origin, that's another one. If you have hematochromatosis, that's another thing, meaning that there's iron building up in your body. So that's another thing. If you have also been diagnosed with PCOS stands for polycystic ovary syndrome. That's another thing. Women, you need to be careful here. So in summary, I would like to give you a formula that even if they wake you from sleep, you should be able to say all these things without wasting time. So the formula, here it goes. 3PFI. So the 3P stands for polydipsia, polyuria, and polyphagia. So those are the meaning for the 3P. And the FI stands for fatigue and infection. And most of the time, the infection here, it is fungal infection that affects the part down there. So far, so good. I've now answered the question from this customer and my regular viewer and follower. So remember the symptoms. Don't become a patient with diabetes. This is my message for you, and make sure you love my channel, you subscribe, and share it with your loved ones. Thank you, and remember, there is only one you. Take care, Dr. WAN.